This comes at a time when the Health Department is suspending all officials implicated in the Digital Vibes tender corruption scandal. 7 officials have been named in the Special Investigating Unit report, which was released publicly yesterday. Minister Joe Phaahla has announced 6 of the 7 officials will receive suspension letters before the end of today. Of course, one is already on precautionary suspension. Our reporter Heidi Giokos has been tracking the story. She joins us now. Hello, Heidi. So we know the department is going to be sending out the rest of those suspension letters, we're told, by the end of today. But, of course, real concerns about governance. What is the Health Minister saying?
Yes, Sally, so we know and understand that 10 health officials have been implicated in the Digital Vibes contract by the SIU report, that the SIU report was released yesterday. We do understand, of course, that the 3 officials out of the 10 no longer work for the Department of Health, but they do work for other government departments. We also understand that 7 of the officials have been given precautionary suspension letters, and by the end of business today, according to the Health Minister, this will happen by the end of business today. So we do understand that one of them includes the Director General, which is Dr. Sandile Buthelezi, the then Acting Director General, Anban Pillay, as well as the Head of Communication, which is Popo Maja, and other key officials within the Department of Health. Governance is a huge issue and a concern. The Department of Health is a department that South Africans were looking to during this pandemic and looking to get answers and clarity with regards to vaccines. And when there's a report that fingers the departments and key officials, this is a huge concern for the departments, and they have to sort out governance as well as making sure that their due diligence processes are re-looked at, given the fact that this Digital Vibes contract happened right under their noses. But let's listen to the Health Minister.
We're also committed to clean governance. And despite the fact that this does make the situation, as you can imagine, in the department very uncomfortable, we're talking here about a big number of senior officials who are implicated, who work with all of us on a daily basis. But, you know, we take this, very seriously, and we will tighten controls and ethical practices. We take seriously the evidence gathered by the SIU.
So this is important. This process has to be followed, a disciplinary process within the department, but also any potential prosecutions that have to happen. That is going to unfold. But what about getting back the money? We know that the SIU did a few months ago put in a preservation order for about 22 million rand, but we know that this contract was worth at least 150 million rand. Do we know how much was potentially stolen, how much the SIU is hoping to get back?
The SIU, in fact, Sally, is trying to recoup 150 million rand. They have already been able to recover about 22 million rand of the 150 million rand. And it's just important to highlight, when we asked the Department of Health today during that press briefing what the plan is and whether or not that 150 million rand has impacted the department at all. And of course the answer was yes, because if one remembers last year and very early this year, when the department was in the process of procuring our vaccines, South Africa was one of the countries that was left behind, because more advanced and richer economies were able to procure and grab those vaccines very quickly. And if that 150 million rand was easily available, surely we would have been able to get more vaccines. The department saying that it has had a huge impact on their COVID-19 process and just procuring things that they needed, especially for the COVID-19 campaign and the vaccine rollouts. But according to the SIU, they're on track to try and recover as much money as possible, and they're aiming for 150 million rand, which they believe was irregularly spent in this Digital Vibes contract. Let's listen to the SIU.
We started with the freezing of the 22 million rand that was already in the bank accounts of some of the people that we are having to recover from. And that money is waiting for the process that has just started. We have now put the matters to the special tribunal, wherein we are going to try and set aside the contract. And once we have done that, we then recover the whole 150 million rand, and which means we'll have to follow the money like we have done in the report to make sure that we know who benefited how much. And then all of those people, there are about 30 respondents already. that needs to come and explain why the money was given to them, and therefore at the end of the process we'll be able to know how much exactly we'll be able to recover.
Yeah, and you know, it's such a crucial issue, Heidi, because that is taxpayer money. That is money that we give from our salaries, and that needs to be spent properly and accounted for. So that is somewhat encouraging to hear. But the SIU report is also quite clear that they are following up on new information. So, Heidi, you've been at that media briefing today. Did you get a sense that there might be more still to come out of this Digital Vibes scandal?
Definitely more to come. This is far from over, Sally, and I tried to work my charm. Unfortunately, it did not work with the SIU, but they did confirm to eNCA today during a live crossing that they are following up on new information that could possibly lead to their investigation being furthered. And once they are done, they will provide that full report to the President. In the SIU report currently looking into Digital Vibes, we do understand that the SIU makes it very clear that this is not a final report, and even if it is a final report, they still have scope and capacity to look further into any detail or information that is brought to their attention, and now currently working on that. And as soon as it's available, we will know exactly what they were investigating and how it's linked to Digital Vibes.
And then, of course, the news just a few moments ago that the President is going to be addressing the nation at 8 o'clock tonight. It's widely expected that he could ease restrictions, perhaps taking us to lockdown level 1. We know, and we've been watching the COVID numbers and the COVID deaths coming down every day. Also that positivity rate, which is a crucial marker of what the pandemic is doing. What are you, and I know that you've been speaking to health officials all week in Gauteng. What are your expectations this evening, Heidi?
Yes, Sally, I think the expectation and the prediction is that the country will most likely move into adjusted level 1. Many are calling, and I actually spoke to Professor Shabir Mahdi yesterday from WITS, that indicated that the President should consider taking away and going away with the National Disaster Management Act, because the position that the country is currently in, and with the vaccine rollout, those lockdown measures don't necessarily work unless we're moving into a very dangerous wave. But the prediction is that even when we move into the 4th wave, it won't be as bad as the 3rd wave, because where our vaccine rollout program is at the moment. What's also crucial is that when you look at deaths and the positivity rates and hospitalizations, that has also decreased significantly. And that is always a marker and a point that health officials look at, and of course the President with his team will consider. So positivity rate has dropped significantly. It used to be over 30%, and in the last 2 to 3 weeks it's been below 10%. So that's a positive sign that we're moving in the right direction. And if we increase vaccine rollout, that is an even more positive contribution to going away with lockdown levels.
Yeah, and that is a crucial issue, because we have a few months before the 4th wave to get those vaccine numbers up. Thank you so much, Heidi Giokos.